So Jennifer is back, and we're going to do the counseling session on how to decrease her bladder spasms. Jennifer, you take Excedrin tension for migraines.
Yes.
That has caffeine in it. That's a necessity. That's not something you would necessarily change. But you also have problems with like citrus, and that's a bowel irritant. And every once in a while you get a bite of that. And then you've stayed away from tomato-based foods, but you do say that it's hard to avoid the corn syrup, and that is probably also exacerbating your symptoms. So I think this is probably fairly easy to resolve with just the first line modifications. And we have kind of talked about it. You don't do coffee. You don't do any caffeinated teas. However, there is trace caffeine in even decaf teas. You're not a big chocolate fiend, although you do like chocolate.
Yep.
And so I think it's really that you're sensitive to the carbonation and the caffeine, as well as the NutraSweet.
Okay.
So I would just have you back off and maybe slowly decrease the amount of artificial sweetener that you take in.
Okay.
So instead of those 3 pops a day, diet pops, then you might trickle that down, taper that off so that you don't give yourself a headache, because I know that you're trying to manage the headaches that you have, and it's having an effect on your bladder. Obviously, the blood pressure medication is something that you need.
Yep.
Until your doctor says you don't need it anymore. There might be something that you can talk to them about when you go in next to see if there's a better medicine that isn't going to pull so much water. Maybe that'll happen next time you go in. That's something to talk to them about anyway.
Okay.
So I just want to go over kind of how the system works. We drink water, right? Our bladder fills up, and as we age, we actually lose compliance in our bladder, and the compliance means that our bladder doesn't stretch as much. So we might actually, as menopausal women, we may actually have